The Challenge initiative offers a demand-driven approach that allows local governments to lead their own sustainable family planning programs. In Francophone West Africa, TCI works at the sub-national level to advocate and engage local leaders to improve contraceptive use in poor urban communities in Côte d'Ivoire, Benin, Burkina Faso, Senegal, and Niger.
The OPCU usually works at the central level, so we work a lot with the ministries of health, but we do understand the importance of working with other leaders, national leaders, at the subnational level, and I think that's where our work is complementary, where TCI is focusing a lot on those local leaders at the community level. We also, one of our big focus for leading up to 2030 is on social norms, and I feel like, and I really believe that the work that we're able to do on demand creation and transforming social norms that up until this point have been hindering the progress of uptake for family planning is going to come from mayors and local communities. And that's why the work that TCI does is very valuable to the Ouagadougou partnership. One thing I really believe in is local ownership of all of these health education programs.
TCI builds self-reliance by strengthening local capacity in health systems through technical assistance coaching. Cities bring their own resources to the table and then lead the implementation of TCI's high-impact interventions.
I think that's the best way to make them sustainable. And obviously, the transfer of power, be it financial resources, human resources, technical capabilities, is extremely important. And I think that's the best way to make a program sustainable.
While TCI focuses its work at the local level, it partners with organizations such as the OPCU that advocate at the national and regional levels to improve overall access to family planning services.
So tapping into the resources that mayors and local leaders have, I think, is extremely important, and not just focusing at the central, regional, and global level. I think it has to come from both parts and meet somewhere in the middle to increase the uptake of family planning. And I think one great aspect is the fact that TCI allows the OPCU and OP direct access to mayors and local leaders. So they're able to join our movement in a much more strategic way, but we're also able to tap into not only their resources, but also their knowledge and their advocacy reach, either reaching the central government or even global leaders about increasing funding for family planning.
TCI University's Francophone West Africa Toolkit offers high-impact interventions designed specifically for this region and the local context. Find out more at tciurbanhealth.org.